Hi, nice to meet you all. My name is Dr. Ragavan. I am a Uro-Oncologist. I am a specialist in urological cancers. Hi viewers, we are going to meet one more time to talk this time about renal failure and transplantation. Renal failure, especially in South Asia, is becoming a very important problem. We are blessed with two kidneys, and when both the kidneys fail to work adequately, we term it as renal failure. Keep in mind, it's not necessarily that we need both the kidneys to work well. For some patients, we remove one of the kidneys for various reasons, including tumors, not able to work well, or infection, and the other kidney can cope and work equally well in order to maintain the kidney function of the body. However, when one or both kidneys continuously fail and is not able to perform the work that they are supposed to do, we call it renal failure. The kidney has lots of important work to do that includes production of urine and disposal of waste from the body, and it also has other softer components including production of some of the hormones which helps in formation of blood. It helps to maintain the blood pressure of the body as well. When the kidney function comes down, these factors get affected. One of the most important things that gets affected is the ability of the body to dispose the waste. So what are the things that the patients will notice when they are heading towards renal failure? They may not find that the amount of urine they are passing is reducing with time. They may feel tired. The family doctor will notice anemia. They will also start seeing bone losses because of various reasons. And as the days progress, they will feel more and more tired and disoriented. We call it azotemia, which is a situation where the waste component is increasing in the blood, and that is making the patient physiology very disturbed. What causes renal failure? In India and Bangladesh and South Asian countries, the most common cause of renal failure is diabetes related. Then there are other components like blood pressure, which is not controlled well. Other components called nephropathy also causes renal failure. Extremely rarely, removal of both the kidneys can cause renal failure. But common things are still common. So diabetes is the most common thing that is causing renal failure. So how to prevent renal failure? How to look after your kidneys? The first and foremost thing, as I always tell, is awareness. The awareness that a kidney failure can happen if I abuse the kidney is an important component to it. You can take a good control of your diabetes and blood pressure. Make sure the diabetes levels are well maintained within the limits that is acceptable. Make sure the blood pressure is controlled well over time. Make sure you drink adequate water. This is prevention of renal failure. This may not work once the renal failure is set, but making sure adequate water intake, 2 liters a day on an average for an adult, is a good idea to make sure the kidney is flushed well. The same token, you don't need to drink buckets of water. You don't need to drink 5 to 6 liters of water. 2 to 3 liters of water a day is adequate enough. Make sure your salt content is not very high. That also does not mean that you should be salt free. You should take adequate salt, but only what is required to be taken. Definitely smoking increases the risk of renal failure because that affects the arteries and the veins, which in turn causes renal failure. So smoking is an important component that you can do to stop renal failure happening to you. Once an established renal failure patient is there, how to manage them? In the initial period of renal failure, a patient doesn't need much of dialysis or transplantation. Only when the creatinine reaches a critical point, which is a reflection of the kidney function, transplantation is considered. And even when the renal failure has started off, by taking some adequate steps, you can prolong the period before you end up with a dialysis. And some of the patients may not require dialysis at all or transplantation at all. But once you reach the stage of dialysis, do not hesitate to start it. You are not going to gain anything by postponing dialysis infinitely. So dialysis has two types generally. Something called hemodialysis, where you come 2-3 days a week to the hospital. You're connected to your blood vessels, and the blood is taken out, cleaned, and put back again. Other is called peritoneal dialysis, where a tube is left in the tummy, and overnight we put in fluids and take out fluids in order to clear the body waste. Once a patient goes into dialysis, they are looking at transplantation, kidney transplantation, as the long term perspective. Now, a few words about transplantation. Transplantation is taking a kidney from a different individual and putting it in you and allowing that kidney to work well. The science of transplantation has improved so well that we are able to do it successfully in the vast majority, and once transplanted, the patients have an excellent quality of life lasting for many years. However, we need to keep in mind that an appropriate donor is the one that is required. And who is an appropriate donor? One who is related to you. Somebody who is your brother, a sister, a cousin, who is related to you by blood is an appropriate donor than somebody who is walking on the street, or even a wife, because she may not be blood related to you. So an appropriate donor will have a much better match to your body, and hence that kidney will work well in your body if fitted inside your body. The surgery and recovery for transplantation has become so well perfected nowadays that the majority of the patients do very well after the transplantation. So to summarize, kidney failure is a common problem. It is very easy to prevent it by making sure that we take adequate control of diabetes, hypertension, and make sure adequate water is taken on a periodic basis. But once kidney failure establishes, do not hesitate to get into dialysis and a transplant program. Thank you.